The debate on mandatory vaccination has been heating up for some time as government aims to vaccinate a large part of the population before the end of the year. Wits University has proposed mandatory testing for unvaccinated staff and students at their own cost, but the university's SRC is opposing this. Let's talk more about this with the Director of Operations and Sector Support at Universities South Africa, Linda Meyer. Linda, thank you for making time on the lead this afternoon. The UCT Senate voted in favor of a policy proposal to make vaccines mandatory as of next year. The senior executive at Wits University also releasing a proposed mandatory vaccination framework. Though that's being rejected by the SRC, what's your position on this as Universities South Africa?
Thank you and good afternoon. The first issue obviously is that there is no enabling legislation in South Africa that can mandate anyone forcefully to be vaccinated. But what the legislation enables in terms of Section 9 of the Constitution for Property Rights and the Higher Education Act, as well as the Occupational Health and Safety Act, is that workplaces and places of public access have the right to limit entry to their premises. So they may set particular rights for people to access those venues. So our position is that universities obviously are able to make these rules to say who may or may not access particular parts of the university, but that this must be done hand in hand with stakeholders to ensure that they go along on the road and the journey of preparation of how this will be implemented and how it will impact stakeholders within the university community.
How would it work? Would students be required to produce vaccine certificates and maybe link that with the students' perhaps access cards?
Yes, so what some of the universities are proposing that. They are saying to get access to the campuses or the precincts, that particular sections of the university, they will require that this vaccination certificate be made available. Alternatively, that you will load it online and it will be linked to the university student access cards and to the staff access cards. So students will only have access to particular parts of the university that will give them access that is in line with what is permissible. As the university, the councils have agreed, and this will then obviously be implemented within that frame.
Yeah. So from the proposed policies that I've seen so far, students who elect not to be vaccinated on constitutional grounds will be expected to undertake weekly testing. The SRC says that will be costly unless universities pay for that. Do you think it's possible for universities to at least concede on that point or find some consensus with the students?
Yes, absolutely. I think that it is a very expensive exercise, and obviously for students that are getting NSFAS funding, to go and get these weekly tests will be costly. But we must weigh this against the greater good of what the universities are trying to achieve. And our energy must be focused in making sure that there are advocacy campaigns, that vaccinations are readily available on university sites, and where this is not possible, that we provide transport to assist students in getting their vaccinations. Where there are students that have underlying comorbidities or staff that have underlying comorbidities, they obviously cannot get the vaccine, and there needs to be mechanisms in place to mitigate this and to assist them through these processes. The SRCs are raising legitimate concerns around financial constraints in students being able to access these sites and going for these tests. But our energies, as I said earlier, really should be focused to what is in the best of the greater community cohort and what it is that we need to do to educate individuals to understand what vaccines are, why they are there, and why they should be implemented. The road is always harder when you try and force things on people. You know, it goes back to systemic issues when people are thinking about pass law controls, when they could not access particular parts of cities and workplaces. So this is a deep systemic issue, and we must be mindful in our discourse how we approach this, and that stakeholders are brought on board, and that we do this collaboratively in the interest of everyone.
Yeah, because you need the buy-in of all the stakeholders, right? Because it's one thing to say we are implementing this mandatory vaccination policy, but there's some work that universities have to do to teach students about the role of vaccines, so that you reach out to those that may be on the fence or have chosen not to take the vaccine because they don't have enough information or that they have been fed with false information. Are you satisfied so far as Universities South Africa with the work universities are doing to teach the pupils more about vaccines and how beneficial they are, as opposed to just put out these policies?
So I think that in any policy fray we can always do more. But I must commend Higher Health and the Department of Higher Education and Training, the SRCs, SAUS, all the stakeholders that have come together have worked collaboratively with us to ensure that these campaigns are advanced. But at the end of the day, we must be mindful of who our stakeholders are and how we communicate messages, and that people don't feel excluded, but that they rather feel part of the journey, and that we ensure, as you said earlier, that the advocacy campaigns are at the center of what it is that we do to ensure that as many people as possible are vaccinated. Why is it that we say that people need to be vaccinated? Because their chances of mortality, their chances of infection rates, and also their chances of mortality and transmissibility is extensively reduced once they have been vaccinated. And this is scientific arguments. And I think we must be mindful not to center ourselves and our arguments in non-scientific debates, but when there are real socio-economic challenges that students are raising, that we need to engage with those within our stakeholder communities to ensure that we bring everybody on board as valuable stakeholders.